Welcome back to my channel, and if you are visiting this channel for the first time, you are also highly welcome. In this lecture, we'll be looking at the anterior pelvic wall. This is the part 2 lecture on the pelvic walls. I've done the part 1 lecture on the pelvic floor where I described the structural component of the pelvic floor. But for the purpose of this class, we would be focusing on just the anterior wall of the pelvic cavity. Let's use this bow here for illustration. Let's use this to represent the pelvic cavity. And in the anterior part here that is harrowed here in blue is where we have the anterior wall created. So let's drive through this lecture to see the structural components of the anterior wall of the pelvic cavity. So before we dive into this, let's try and establish the walls created by the pelvic cavity. The pelvic cavity is seen to have 5 walls. So going back to this image, let's use this structure here to illustrate or represent the pelvic cavity. We know that the pelvic cavity is superiorly continuous with the abdominal cavity. So above the pelvic cavity, superiorly here, we have the abdominal cavity, while of course inferior to the abdominal cavity is where we have the pelvic cavity. The pelvic cavity is seen to have an anterior wall, and the anterior wall, as the name implies, is located in the anterior part, while behind we have the posterior wall, which is like the barricade that is created posteriorly. Then on both lateral sides, we have 2 lateral walls, one on each side. Then finally we have the inferior wall, which is the inferior limit of the pelvic cavity. This is also referred to as the pelvic floor. But for the purpose of this class, we would be focusing on the anterior wall, which is this region here that is harrowed in red. So this lecture will be concentrating on the anterior wall and also trying to establish the different structural components that are seen around the space. So the anterior wall generally is the shallowest wall when you try to compare it in terms of the alignment that it runs with the other walls that are created by the pelvic cavity. Let's use this image here also for illustration. In the anterior part is where we have the anterior wall. Posteriorly, we have the posterior wall, and on both sides, we have the lateral wall that is harrowed here in yellow. We know that at the inferior limit is where we have the inferior wall that is also referred to as the pelvic floor. So if you look at the alignment that the anterior wall runs, that is demarcated here in dotted black, you see that the distance that it runs is the shortest when compared to the other walls created by the pelvic cavity. This also tends to tally with the level where we have the coccyx. If you look at the posterior wall of the pelvic cavity, one of the structural components is the coccyx. This is like the most terminal region of the vertebral column. So at this point here is where we have the coccyx. The coccyx is seen at the same level where we have the upper border of the pubic symphysis. The pubic symphysis is in the anterior part. We'll soon be getting to this region as we go through with this lecture. So if the coccyx can be at the same level with the pubic symphysis, it means that the region that the sacrum runs is already chopped off. So the upper border of the pubic symphysis, now seen to tally with the level where we have the coccyx, then goes a long way to show that the anterior wall of the pelvic cavity will be the shallowest. So we see that when you compare the length that it runs with the posterior wall and also the 2 lateral walls, you see that the anterior wall is seen to run a short course when you compare it to the other walls of the pelvic cavity. So now driving further on the structural component of the anterior wall. What is the anterior wall of the pelvic cavity made up of? The bulk of the anterior wall of the pelvic cavity is made up of the pubic bone. The pubic bone is the ventrally placed bone. If you go back to the bone in pelvics, I've done a lecture on the bone in pelvics. If you've not checked that lecture up, please kindly go and do so. If you go through that lecture, you would be able to establish the different structural components of the pubic bone. The pelvic girdle is structurally made up of 3 subcomponents. We have the ilium, we have the pubics, and we have the ischium. So if you look at this region here that is demarcated in dotted black, this is the region where we have the pubic. The pubic is part of the pelvic bone, that is located in the anterior part. If you go more posteriorly behind, you have the ilium, and this is what is harrowed here in purple. And also, if you go more inferiorly, at the posterior part, you have the ischium, and this is what is also arrowed here in purple. But if you come to the anterior part of the pelvic bone, you see that the bone that is seen in that region is the pubic bone, and this is what is demarcated here in dotted black. So we have different subregions of the pubic bone. So let's drive further to see the different subregions and also how they are related to the anterior wall of the pelvic cavity. So we have the posterior surface of the different subregions of the pubic bone contributing to the formation of the anterior wall of the pelvic cavity. This is the pelvic cavity, and of course, it's the surfaces that are located behind it that will be forming the anterior wall of the pelvic cavity. So we have the first subregion, we have the body of the pubic. This is the body of the pubic here, arrowed at this point. We have one on one side and we have another one on the other side. So the body of the pubic bone, at this point, is where we have the joint created, and this is where we have the pubic symphysis. So you see the pubic symphysis here harrowed in black. So specifically, it is at the body of the pubic that the right and the left pubic bone will be connected to form the pubic symphysis. We also have the superior extension from the body of the pubic bone, and this is the superior ramus. So we have the superior ramus here arrowed in yellow on one side. We also have another superior ramus here also arrowed in yellow. So the two superior rami are also seen to form the structural component of the anterior wall of the pelvic cavity. But specifically, it is the posterior surface of the superior rami of the pubic bone that is seen to contribute to this formation. If you look deep into the superior ramus here at this point, you see that finally it terminates to contribute into the formation of the acetabulum. This is where we have the acetabulum at this point. The acetabulum is a fossa or an indentation that is created on the lateral part of the pelvic bone. This is what receives the head of the femur, which of course is a structural component of the lower limb. So we see the lower limb attaching to the pelvic bone through the acetabulum. And of course, this acetabulum is also formed from contribution from the pubic bone, specifically from the superior ramus of the pubic bone. So looking through the superior extension from the body of the pubic, we have the superior ramus on one side and also on the other side. So apart from contributing to the formation of the anterior wall of the pelvic cavity, they also seem to contribute to the formation of the acetabulum. Then inferiorly, you also have an extension from the body, and this is the inferior ramus. And this is what is seen to be harrowed here in red on one side. Then you have another inferior ramus on the other side. The two inferior rami, which of course are inferior extensions from the body of the pubic bone, are also seen to contribute to the formation of the anterior wall of the pelvic cavity. But specifically, it is the posterior surface of the inferior rami that is seen to contribute to this formation. So if you also drive in through this, you see that the inferior rami on both sides is seen to form the pubic arc. This is where we have the arc-like structure that is created at this point, and it is formed by the inferior extensions from the body of the pubic bone, which are called the inferior rami. So you see the pubic arc formed here at this point. This pubic arc is usually larger or wider in female, and this is to contribute to increasing the space that is created by the pelvic outlet so as to enhance easy bed process. So you see that the different regions of the pubic bone are contributing to the formation of the anterior wall of the pelvic cavity. And this forms the bulk of the structural component of structures that are seen in the anterior part of the pelvic cavity. So let's also drive in to look at the joints that is seen in the anterior wall of the pelvic cavity. In the anterior wall of the pelvic cavity, we have the pubic symphysis. Remember this alignment that is created at this point. We say that the pelvic girdle on one side will be connecting to the pelvic girdle on the other side, anteriorly through the pubic symphysis. Posteriorly, the connection will be done through the pelvic spine. And this includes the sacrum and also the coccyx. So if you look at it behind, you see that there's a connection with the sacrum, while at the front, the pelvic girdle is connected a specific region. And the specific region where this connection is created is at the body of the pubic bone. This is where we have the pubic bone on this side. This is the pubic bone on the other side. So specifically, it is the body of the pubic bone that we have the connection point that is referred to as the pubic symphysis. This pubic symphysis is what is seen to be arrowed here in blue. So you have the body of the pubic bone on this side arrowed in red, and of course on the other side also arrowed in red. And you see these two bodies coming together at this point to unite to form a joint. And this is what is referred to as the pubic symphysis. The pubic symphysis is a cartilaginous joint, but it is specifically classified as a secondary cartilaginous joint. So this is the joint that is also seen in the anterior wall of the pelvic cavity. Then the other structure that is seen in the anterior wall of the pelvic cavity are ligaments. These ligaments basically are seen to anchor the pubic symphysis. We know that we have a number of joints created within the pelvic cavity, and one of which is the pubic symphysis. This pubic symphysis needs to be supported by ligaments, and these ligaments are also taken as part of the structural component of the anterior wall of the pelvic cavity. So we have a number of ligaments at this point. We have the superior pubic ligament. This is the superior pubic ligament. The superior pubic ligament, just as the name implies, it is seen to reinforce the pubic symphysis superiorly. You see ligaments at the upper part of the pubic symphysis. We also have the inferior pubic ligament. This is the inferior pubic ligament here, highlighted in red. This inferior pubic ligament is seen to reinforce the pubic symphysis at the inferior part. If you look through the pattern by which the inferior pubic ligament is formed, you see that it forms an arc-like configuration. So this arc-like configuration is as a result of the pubic arc that is formed by the inferior rami of the pubic bone. So you see that this pattern also runs in alignment with the pattern of the pubic arc, and this is why the inferior pubic ligament is also referred to as the arcuate ligament. We also have the anterior pubic ligament and also the posterior pubic ligament. The anterior pubic ligament, just as the name implies, you see it reinforcing the pubic symphysis anteriorly, and this is what is seen here that is demarcated in purple. You also see another strand that is seen posteriorly to reinforce the joint, and this is what is highlighted here in dotted blue. So this ligament, you see that they run in different patterns and also positioned in different regions around the pubic symphysis. They are so positioned to reinforce the pubic symphysis and are taken also as part of the structural component of the anterior wall of the pelvic cavity. So thanks for watching this video. Let's continue to stay glued to this channel.